Hey everybody, thinking I should call these Cory's Corner or something like this since I keep taking them in my little desk corner. But topic I want to talk to you about today is when we first have when we have pain when we first move. It's real common. We hear it all the time in physical therapy. Depending, I mean, really, kind of no matter what the problem is, musculoskeletal issues. It's a very common issue. It's also one of the longest to last. It's one of the last things that goes away. It's also one of the first that people tend to have problems with. It's like when you're sitting and you first go to stand up and your knee hurts more, or when you've been laying down and your first reach with your shoulder, it hurts more. Whatever the body part or whatever the motion, when we've been inactive for a while and we're having problems, a lot of times the first movement hurts more. So, for one, people often want to know, is that normal? And it is. It's very common. It's not distinct to any particular musculoskeletal issue. Pretty ubiquitous. Most musculoskeletal pain issues have that as a symptom. So it doesn't really tell you anything in particular to be worried about. It's not indicative of any particular issue or damage or something like that, which is important because a lot of times when it hurts to move like this, people are worried that they're damaging something, they're making something worse, which is totally sensible. But again, it's real common, not really an indicator of any particular damage. So why does this happen? Why do people have this problem? Well, it's really just an extension of something that's totally normal. Imagine you had to sit on a plane, a 3-hour ride or a 4-hour ride or something like that on a plane, and you can't really move. You're stuffed into this little seat. In a normal situation, without having a problem, someone's not going to feel great after that amount of time. I know I'm in misery after a few hours of a plane ride. So to a certain degree, this is part of the process even when we're not having pain. The problem is that when you are having pain, when there is something going on, it amplifies it, right? We feel it more quickly. It's not just stiffness, it hurts. It seems more severe. So it tells us a couple things. So for one, we know that when we have pain, our entire system is a bit more sensitive. So, really, I like to consider this, it's like our body kind of telling us that we need to move, actually. It's kind of trying to prompt us to get moving. So that's another important question. How do I know if the movements that I'm doing are working or not? So with my patients, I say a lot of times, what you're looking for is this warm-up effect, which basically as you do more of the movement, it starts to get easier, it starts to feel better. Or even better, if you do a couple of sets or 3 sets of it, let's say you're going to do a motion and you're going to do 3 sets of 10, right? A lot of times the first set doesn't feel so great, but then you take a brief break, come back to do the second set. A lot of times that feels much better, or you feel like you can push a little bit harder. You just feel more confident, and a lot of times by the third set it's even better yet. So that warm-up effect, that effect of it getting better as you do more of them, or feeling easier as you do more of them, is a very good sign, and that's really what you're looking for. So you can use that effect to your advantage multiple times throughout the day, giving yourself little breaks, little movement breaks. There's another therapist in the UK who calls it taking movement snacks. Ben Cormack is his name, which I think is perfect. Taking little snacks of movement to keep your body feeling good and feeling comfortable. So that's one important thing. And as you get better, you'll feel like a lot of times it goes from a localized, really specific area pain, it hurts right here, to then becoming a more diffuse, kind of generalized, it hurts in this area, and it's might become more achy, to where it gets to where it's feels more like stiffness or something, right? So that's pretty typical, and that's some ways you can kind of monitor whether or not you feel like it's getting better. It's also very common for it to wax and wane, for it to kind of get better, feel like you lose a little bit of ground, and then it get better again and you lose a little ground. So it kind of has this jagged recovery slope. That's very common as well. Another thing that's really common is you'll feel better in one group of activities, but then as you start to experiment with doing more challenging things, then it feels worse again, which is again totally normal. You're asking more of it, more straining motions, that it just hasn't had a chance to get used to yet. So again, you'll kind of go through that same climbing out of it process where it waxes and wanes a little bit. So again, very common, something that we can help you out with if you're not sure, whether it's something that that you're safe to be moving on, something you can let us take a look at for you. But just some thoughts on a really common issue, this pain with first movement.